Hello and welcome everybody. Can everybody hear me well? Yes? Okay, good. Welcome to this DHIS2 LMIS tech session. All right, so my name is Brenna Horst. I'm the LMIS technical lead, and very shortly you'll be presented by George Maguire, who's our LMIS technical advisor. All right, so I'm hosting the session and George will be presenting. Following George, we'll have ICRC, so the Red Cross, presenting their PSM tools for transaction-based stock management using DHIS2 and integrated with the central ERP. And then we'll be finalizing the session with a presentation from Zabi Kamran from Unicef, who will present Thrive 360 as a national control tower for immunization supply chain. So those are the three exciting sessions we have for you today. And I'll just give a very brief preface to the session, just to set the stage for what you'll be seeing here, all right? So as I said, George and I are working here at the HISP Center at the University of Oslo as the LMIS core team. We have a few people that are joining to support our work, and then we're promoting this within the DHIS2 community for using DHIS2 for within the LMIS field. The preface or kind of the introduction to the session that I want to give is that we've been here for just over 2 years developing this, what we call a best practice approach. But DHIS2 has been used for stock management and cold chain management for many years, long before George and I joined the team. We came on board then beginning of 2021, very much as a pull. This was being done in different ways in different countries. And then our main task was to come up with this best practice. How do we promote how DHIS2 should be used and also not used and not overused to ensure that you're meeting requirements for efficient and standard supply chain management, all right? So within that approach, we've worked on stock management, cold chain and biomedical equipment management, and temperature monitoring. Now we'll be presenting two of those, the transaction-based stock management tool, the real-time stock tool, which Marta also alluded to in the presentation this morning. George will also show the cold chain equipment management configuration and tool. The third pillar of that, the temperature monitoring, is something that is still under development, but we have Philip Larson here with us, who was the app competition winner last year, who developed a pilot and MVP, which was tested in Mozambique. And then we're looking for partners who will join with us to work together on that, on the temperature monitoring. But we're excited about that as well. All right, so then what we're focusing on with this approach is last mile. So really focusing on facility level management, digitizing facilities, and integrating that with a central level tool, with an LMIS or ERP. So very important, and this is what we say again, that we should use but not overuse DHIS2 when it comes to supply chain management. So we really promote integration. We invited multiple LMIS partners to join us at the conference. We have Mathieu from iPlus Solutions, who's working with the Medexus LMIS. We have a large delegation from M-Supply, Craig, and others, so welcome to you guys. We invited others as well who couldn't make it, but we really promote exploring what suits your country and your needs best. We promote, of course, using DHIS2 at the last mile, and we'll work with all of these partners to integrate to provide end-to-end supply chain management. All right, we'll be available after Expert Lounge, Use Case Bazaar will be omnipresent during the conference. Feel free to reach out to us. All right, so without further ado, I hand over to George Maguire.
Okay, thank you very much. Screen saver. Okay, I will only present 2 slides and then do something risky to try to give you a demo. It won't be as much fun as in the morning. I'm not a trained actor, but I hope the system works, right? So just to set the stage, what is the problem we are trying to solve, right? Because we are giving you a solution, and I'm going to go on and on about it, but of course, we shouldn't lose track of the problem. So this is a short introduction to my lifetime drama about stockouts of 30 years. So I trained and worked as a nurse. That's a place I worked in the intensive care unit in Austria, but I always wanted to become a humanitarian worker. So they sent me to this lovely place, Afghanistan. Like Savi has been there, many people have been there. And I was a nurse. I didn't have any logistics training. I was in charge of managing quite a sizable stock, like a warehouse actually, for some hospitals and some clinics. And I thought I was doing everything right, recalculating, you know, taking effort, counting my stock. But I had a problem that was stockouts, right? So every logistician knows that. but I couldn't quite figure out why I had that stockouts, why the lead time was long, and I was calculating and recalculating, and it didn't seem to get any better. So I figured it was time to do some learning. I went to Cranfield University to study logistics. And there I had an enlightenment on a session of about demand distortion, the Forrester effect, the bullwhip effect. And I understood this is one of the problems, why there are so many stockouts and shortages, or why I had them. But I'm sure I'm not the only one. So I went on to study for a PhD. And one of the main conclusions is that you need facility level data in order to reduce demand distortion. So you can see how cheap PhDs in logistics are. You know, that's like 2 years of research. On the other hand, I must say that I don't hear a lot of people talking about the bullwhip effect, and it is pervasive. It's a problem everywhere in the supply chain, even if you haven't seen it. But that's just a theory. There's only one person on the planet who has actually read this paper, which is me, my supervisor. Well, but that's a theory. It's in a library. And what now I have the pleasure of working on a practical solution since 5 years. Just to mention, this is my 5th attempt. I've done a university project with an app that was never used. I've developed my own app, worked, died. And this is the 5th version, and I think we have an excellent solution. So this is a practical solution. And again, we are trying to solve the problem of stockouts and demand distortion. So why should you implement a real-time tool? Because it gives you end-to-end real-time visibility. You can have a digital tool that is recording your monthly stock counts, but that will not give you real-time visibility. The objective is that of the immediate visibility day by day is that you can resolve the stockouts. So I will show that the district manager can have a report of all the stockouts in the facilities they're supplying, and they can take immediate action today on the 12th of June and not wait until the end of June. You can share your stocks if you're understocked, get some stock from a nearby facility which is overstocked. As I mentioned, end user demand minimizes demand distortion, read my thesis. Also, we are aligning with the TSS, the Gavi TSS requirements. A real-time stock management tool is necessary if you want to have a paperless system. If you have a monthly reporting, you can digitize your monthly reports, but you still need to have the day-to-day transactions written on a bean card and a stock card. And the real-time tool is the only way not to duplicate any data recording, because your bean card and your monthly report, basically you're duplicating data. And the advantage of a real-time tool is that the daily monthly reporting is fully automated. So you don't have to spend 2 days writing your reports. And keep in mind, the ultimate objective of the whole exercise is improving stock availability, reducing, even eliminating stock outs, not more reporting. But of course, we are conscious that you need reporting. Now, next question is, if you agree on using a real-time system, why should you use DHIS2 as a real-time system? It's because of the simplicity. You can use barcoding systems, so linear barcodes, QR codes. One of the main arguments of using DHIS2 in the first place is sustainability. So it's free and open source. It's the cost. You have the global HIST network. As I mentioned, I worked with a university in Switzerland to develop an app over 1 year. That was 2 professors. They published a paper, but the system was never implemented because it was not sustainable. You have the continuous improvement. So you have seen spectacular. Every year you get these new improvements on, tracker, Android, backend. You can use existing global infrastructure. So if you're already using DHIS2 in the country, you don't have to set up a new system. You can basically piggyback on what's existing. You have the synergies with the HMIS system. So the health worker can do the ANC reporting and the outbreak analysis in DHIS2 and use the same system for logistics. You have the offline functionality, but we recommend that if you use a real-time system that you synchronize at least once a day. You have API endpoints for integrating with LMIS. So this is what we strongly recommend as a standalone system. You can use it, but it's of limited usefulness. Our approach of DHIS2 LMIS is to use DHIS2 at last mile at the facility level, But if you want to manage your logistics professionally in any country for any type of commodities, sooner or later you will have to implement an LMIS or an ERP system. And a one-stop shop. So you have the stock management, Brenny mentioned it. I will demo quickly the equipment management, and for the temperature management, we would like to start a project. And automated in real-time daily monitoring, daily monthly reporting. Just to mention, it's kind of free on the house. So we are not neglecting it. It's just that you don't have to basically fill in the reports yourself. Okay, I have to be conscious of time. So what I'm going to demo quickly is how the real-time stock management system works. So what I'm going to show you is a sandbox. There's a public sandbox. You can go on a website and log in. So everything that you see now, you can do it yourself. It's fully configured. It's only if you record anything in the sandbox, it will be reset at midnight. So now with the, as Marta explained, the use case configuration app, if you go on the real-time stock management, it looks like any other tracker program, but it actually opens the customized app. So the main path is for distributing goods. And the use case is that I'm the pharmacist at the hospital or clinic. Every day or every week, the wards are coming to me with a request for certain items and quantities. And I'm supposed to pick them, deliver them to the ward or the service or the outreach worker, and then keep a record without filling in my bin cards. But then, of course, if you have stock that needs to be discarded, you can do that. If you have a stock correction, like if somebody stole a cookie, I do that every day. Then you have to correct your stock, and you can, of course, also do that. Now, we try to keep it as simple as possible with as few clicks as necessary. So by default, I'm going to send the organization unit tree will drop down. Normally, a storekeeper will be assigned to only one place, so you don't normally have to worry about it. And then deliver to, so here's a list. It's an option set, so you can customize it. Let's say I'm going to deliver this to the surgical ward, and it will now show me a real-time list of all the items that I have in stock. So I can search for an item, I can scroll up, down, and just enter the quantity, but we recommend using the barcoding system. So I'm going to give it a try. So I open my barcode scanner. I'm going to scan this barcode. It's FX in. I'm going to go back to the screen. So it has actually found the item. It's just a filter. So I have 10,700 in stock. And let's say I'm supposed to pick 700. I'm going to pick 700. And the beauty of the system is you see that the stock on hand updated to 10,000 in real time, right? So that's why we call it the real-time system, because if you synchronize your mobile device, of course, then anybody sitting anywhere in Oslo, in Copenhagen, in Nairobi, anywhere else can view what you currently have in stock. And it's particularly important, of course, for the supply managers at the district provincial level, that they can follow what's happening. So I'm going to select 2 more items just to show that QR codes, they work even better, they take less space. So I'm going to take 2,000 of those, and that will decrease to 47,000. Take 1 more item. You get the idea. You do this basically all day with your storekeeper. 4,000, and that leaves 1,500. So now I have selected all my items. I will go to review. We'll give me a list of all the items I have picked, so I can still check them and correct it. And if I'm happy with what was picked, I will go and confirm. And that completes my transaction. So that's all there's to do. Yes, thank you. I was just testing your attention. Thank you. So thanks. So sorry you missed that. So the review, and I'm going to synchronize the device. Hope that works. And basically now the data is on, so the synchronization actually worked, and the data is now on the server. So if you're a skilled DHIS2 user, don't forget you're running your analytics tables. I'll do that. I will show you just a few of the analysis that is now available with the native DHIS2 analytics. So this is one of the advantages. Those are improved every year. So instead of actually configuring something in your app, you can benefit from the native functionality and freely customize your report. So what I'm showing is just a suggestion. Just waiting for this to finish. In the meantime, I didn't actually show the main line listing. So I'll jump ahead. So here, this is a list of what you have currently in stock, right? It has not refreshed yet, but you can see if anybody wants in the facility or anywhere else wants to know what you currently have in stock. This is the last recorded stock events. You also can have a list of stock outs. So that's particularly useful for the district managers. And you can see the stock outs not only for one facility, but you could say, show me the stock outs in the entire district or even in the country, and have a list of that. Then, yeah, stock out days. So there's a program indicator, a predictor that is calculating whether at the end of the day there was a stock out or not, and it is calculating this automatically. So you don't need to record it anymore. It also makes it very difficult to cheat because it's automatic now. And this is an overview. Basically, it's the data is not complete, but you get the idea. You can see that on the 18th of April, you started with 2,981, distributed 111, and 2,870 were left at the end of the day. Next day, stock in the morning was 2,870, and so on. So you can have a record of day by day the transactions, and this is also available as a monthly report. Yeah, stock out day count, I already showed that. And here you have, this is particularly interesting from my experience for the hospital managers. If they want to know how many antibiotics have been used by every service, every ward, you can see here on a day-by-day basis for the items and which ward they were distributed to. So I don't know, check if the analytics table has completed, and I'm going to be to try to. I forgot to open the main table, which is like the current stock. So the digital stock card. Let's see if it worked. It did work, yeah. So, sorry, yeah, 114. So you see that here, these are the 3 items that I just distributed on the 12th of June at 114. Those 3 items were distributed. So you see it actually worked. It came from my mobile phone and it went onto the server. And again, anybody who has access to the server can view that. Okay, I think that's what I wanted. Ben, anything to add? Did I miss anything for the stock management? So I just have to blow my nose. Okay. Yeah.
Integrated with the central system, but again, to provide the same end-to-end. So that's the entire approach, focusing on facility level data.
Okay. Conscious of time, but still good. So I'm going to show the second product that we are proud to develop together with Unicef. And that is the cold chain, what we call the cold chain equipment lifecycle management. So this is a tool that will allow you to keep a digital record of an appliance from the day you install it until you dismantle it and have all the intermediate steps. So I'm going to show you as a first step is, let's say you're setting up a new device in a clinic. So I have an example here. This is a refrigerator that you're supposed to set up. So first of all, what we have configured here is we have manually created the WHO PQS catalog so that you don't have to manually enter the specifications. We basically upload it once with the CSV file. So I have a list of all the WHO for the refrigerators. All the devices are here. And I'm going to, oops, sorry, I left. I'm going to go back to my filter. I'm going to select my favorite one, which is Bond, James Bond 007. So here you have the This is a Westfrost refrigerator. You can see these are all the WHO specifications. So it's pre-uploaded. You don't have to enter anything. And but of course, you then have the specific details like the serial number and the production date that you want to add when you set up the equipment. So I'm going to select this item, this refrigerator, and I'm going to jump through a few hoops that are not maybe very intuitive, but don't worry about it. There's a training guide that explains how to do that. And if you do it a few times, you will be okay with that. So basically what I'm doing now is I'm taking this WHO entry from the catalog and I'm cloning it. And I'm going to set it up in a new place, let's say in this clinic here. And I'm going to say that I installed it today on the 12th of June. And you can see here, it says where it is enrolled, and I have the details. So the beauty of the system is that you can see that WHO PQS specifications are already recorded. So this is E003 refrigerator. It's the number 07 Westfrost. It's MK304. And now, ideally, the new equipment will have a GS1 data matrix code printed on the refrigerator that you can just scan. This is an example. So this is according to the PQS GIAI, Global Individual Application Identifier from WHO. And these are the specifications that are like mandatory. So now I'm going to open my barcode scanner. So you have, I'm going to switch back. I'm just going to scan the code. Right. And so GS1 means that all this information is encoded in this barcode, but it also has application identifiers, so the system knows exactly what is what. It's not just a text string. And you can see now that you have the GTIN number here, you have the serial number, the GS1 data matrix string, and you have the production date here. So everything is taken, you take it from the catalog, and the rest of the information comes from the label on equipment. Now you can still select where you have set it up, let's say in the pharmacy. And then last thing, if you want, you can make a picture. So I'm going to add an image. Okay, I can't show you. It says take a photo. Anyway, I'll show you the result. So I'm going to take a picture. And you see it took the picture so that you know which one is which. Refrigerators are often similar, so you have a record. I'm going to save this. And this is a technicality. I'm going to delete the link. And that basically completes the registration. Sorry. So actually, that was just the first step. So I'm going to clear my filters and go back to refrigerator to see what you can do with it, with the application. Okay, so I have all my refrigerators back. This is the one I just registered. I think, yes. Oh. Sorry, I should have written down where I have created an example of what you can register. Yeah, it's this one here. Okay. So let's say I have enrolled my equipment, and now I will not show you all of the steps in detail. So these are individual program stages. So you can record the equipment transfer. You can record the installation of the equipment and the training. And then let's say for the cold chain inspection, if you want to have a daily reporting, let's say whether functional, non-functional, this is basically in this menu. You can have text entries, but you can also have drop-down menus where you just select functional, non-functional, and then you save it. So sorry, I pressed once too many times. So the health worker can basically record the daily checking, the weekly preventive maintenance. Like I'm going to add, this is according to another WHO document, that the routines that you're supposed to do. So water removed from the bottom of the refrigerator, let's say yes. water droplets wiped off. Of course, you're going to say yes for everything. That's, we're all skilled reporters. And you have the monthly maintenance. You can report all the alarms. So if an alarm was created, you can report the cause, what kind of alarm it is, what the cause was, how it was resolved, and whether you escalated alarms. And then you can make a repair request. And again, in the line listing, you can then, the cold chain technician, the biomedical engineer, can then see a list of all the facilities, all the refrigerators that made a repair request. And then the corrective action is for the cold chain technician then to record the actions that they took, the replacement parts, the findings. And if eventually the equipment can't be salvaged, then you can record the disposal. Okay, so I'm just, last few minutes on, so this is not an actual project, but Philip Larsen, the Great, has actually developed last year a fully functional prototype that was demoed, got the App of the Year award, DHIS2 App of the Year award, and we are now seeking basically support and funding to fully develop this in DHIS2. So basically, there's a WHO PQS specification on equipment monitoring system, which basically requires that equipment in future needs to have an integrated sensor, temperature, door opening, compressor, alerts, and that those are recorded on the device for 1 year. And we want to build an app that will read out this data on Bluetooth. It's a requirement that at least every 15 minutes data is updated. And we want to develop a real-time system that whenever, for example, you have an excursion, you have an immediate alert for that. So you can, the specifications say you can connect with a USB cable or with Bluetooth. It's only optional, unfortunately, but we hope that obviously Bluetooth has the advantage that you have the real-time alerts. And there's many systems out there, you all know them. There's dozens of commercial systems. I think maybe 10 or 12 of them have WHO PQS pre-qualification. The problem is that they're quite expensive and they require annual fees. So the idea is to have a tool, but to put it on a free and open source software platform. We want to have fully automated temperature excursion alerts. That's the main purpose. We don't want to have pretty reports. That also, you get it free. But basically, we want that when you have an excursion, you get an alert immediately on your mobile phone. And if nobody's in the clinic, that the mobile phone that you leave on the refrigerator will send an alert by SMS or on DHIS2 to people so they can take corrective action. Daily, monthly reporting will be basically automatic. You don't have to measure temperature anymore. Just pull the data, put it on a nice dashboard that I made. So, and the ultimate objective of what we want to develop is that you have real-time alerts and that you prevent the vaccine from being damaged, and not to tell you Monday morning that you had a freezing event on Saturday and all your vaccine is gone. And this is my last slide for today. This slide is, there's actually a tracker program that we have set up in DHIS2. It's already ready to connect to the app, right? So we have the WHO EMS requirements. We have a tracker program. We just need the software to put it in between. And this is a chart. Of course, it's just demo data that you can get. So you can see here, this is daily reporting. You have the minimum, maximum, average temperature. We want to add the mean kinetic temperature to it. But this just gives you average temperature. So you don't really know much what happened during the day. But here you can see the door opening time, and particularly the time the temperature was below 2 degrees and it was above 8 degrees. That tells you much more than an average daily temperature. So you can especially see the freezing elements. And then in addition to that, here you have the power supply. So you can see it's a 24-hour scale. So you can see here the temperature, the refrigerator was running had 23 hours of power, you only 19.5. Here you had a major problem and the temperature went up. So you can have all this monitoring on a single chart, and keep in mind you can have all of this, hopefully one day, just by leaving your DHIS2 mobile phone on the refrigerator without having to report any day. And Logisticians are never on time, but I am on time.
All right, big thank you to George. Just to say, we're having a small issue with getting the online presenter connected, so we may have to put Zabi on the hot seat and have him present next, but we'll give him a few minutes first and maybe take a couple of questions. We have 2 questions online, and one is pretty much the first one we get every time. Can you manage batch and expiry? First question is, we have that on the development roadmap, and that's an expected improvement, but for now, it's generic management of items. However, when it's integrated with an LMIS or ERP, and we have an example of this, it would be the next presentation if we get her online, that it can be done with the integration, that the central system keeps an order of all items that are shipped, and then based on first expiry, first out principle, you know which items are still available on stock given how much stock on hand. That's in a nutshell. We can discuss and explain more how that's actually implemented in this specific case. The second question is related to order management. Can you generate orders within this system? And that's where the last mile approach comes in, and where we say we do not recommend generating orders with DHIS2. We recommend integrating with a professional supply chain management system with a Medexus LMS or MSupply or others to then say we provide you with the up-to-date information, or if there's a hastening level from this app, but then it should be a type of VMI or vendor management inventory model where they generate orders and that's integrated. And that's another example which also will be presented here, but in the French session tomorrow afternoon, where Mamadou Samake from, I think there's Mamadou in the room. There he is, yeah. So he'll be presenting how this was implemented in Mali. So you can see how that model works there. So, and that was with the Medexus LMIS system. So that's the batch, and the other one on the order management. Now, one last check if Rogina from ICRC is online. And if not, we'll hand over to Zabi to present Thrive 360. Do we see Rogina? Don't know. Okay, so Zabi, over to you.
Hi, Bruno. Actually, I'm here. Sorry.
We'll share some information on the ICRC implementation, which was pretty much this same solution, the transaction-based stock management integrated with Oracle ERP, all right, in multiple projects and their scale-up plan. So that's what, maybe we'll still get her online by the time Zabi is ready or he's finished.
Good afternoon, colleagues. If George was not a train actor, then don't even ask me. So I'll just briefly walk us through on what Thrive 360 is, why we started it, where we are right now, and why it makes a lot of sense that we integrate it within the DHIS2. So a lot of colleagues in the room that you already know, even before the pandemic, we had a problem on hand, and we were seeing this steady increase in stockouts reported in the low and middle income countries. And of course, as a result of that, we're also seeing the increasing number of service disruptions that were reported in those LMICs. And we all know the coverage rates at the same time are also plateauing. And combine that with all the scattered data sources, and there's so many different LMISs in the countries, and we had a problem that created a situation where in the same countries we had excess stocks in one in place and had stockouts in other places. And we will see a few slides of how many different systems the countries have implemented. And of course, then the COVID came, and it already made a bad situation into worse. We have seen in a lot of places of reversing the gains that the program had made over the last 5 or 10 years. And this is a snapshot of how the pandemic affected the immunization programs. We have about 5 million more children who are added to the 0 dose. And we have in some places up to about 5% or more than that reduction in the coverage rates of DPT3. And we also did a mapping in the last couple of years to see what type of systems exist in countries. And as you can see, there are quite a few, 292 different type of LMISs that are implemented in countries, and 2,400 or more HMISs. And we didn't even count a lot of other systems like these BCCs. And even in some countries, they have like 5 or 6 or 7 implementation of the LMIS at the same time. So one province is using a system, and the other province has another LMIS. And what that has created is a opportunity loss, that we do not have real-time data in countries so that they could take it and make decisions that could prevent stock risky situations in those countries. But there were some implications, of course, for both for the countries, but also for us at the UNICEF. And some of them were that there wasn't enough actionable data to prevent or minimize the stock risky situations in the countries. There was a lot of sudden, unexpected request for preponement of shipments, even from countries who just a couple of months ago would report that they had stocks that would last them for another 7 or 8 months, and the next month there is a stock out and they're requesting preponement of their shipments from the next year. And we have also did some mapping in countries where we can see certain geographic areas in the same country which were doing really bad in terms of stock performance and coverage rates, but other parts that were completely the opposite. And that's because, again, so many systems are in place, and that information does not integrate and it does not go to the decision makers in a time that they could take it and make decisions based out of that. So having all of these problems, we started to, and of course, we didn't want to add another system to the 292. We wanted to see how we can leverage the existing tools that are in the countries and get the information out of them and give it to the decision makers so that they could prevent those stock risky situations. So what Thrive does, it is just a data integration hub. It combines the data from the stock data with the consumption, with the shipments, and with the monitoring and evaluation data, and brings them in one platform for managers at the different levels. So here are a few screenshots of what it does. So on a monthly basis, we now get a snapshot of the stocks at the global level, how they're performing, where we are seeing stockouts, how they're faring this month compared to the previous, how the trends are. We also have that with the shipment data, we're just tracking whether there are enough in those countries. If there are low stock levels in countries, are there shipments online in those places, or there would be some imminent stockouts in those places. But moving beyond that, not just looking at the quantitative data, because it doesn't tell you all the story. It just gives you a point, like I have 50,000 doses of a certain antigen. But what does that mean? So we have complemented that with more qualitative inputs to say, what is causing that stockout? What are the major drivers that are repeatedly reported over months and years in certain countries, so that we could find a way to address those solutions. And then, of course, with the COVID, we also did try to monitor a little bit on what stock levels countries had, how they're using that stocks, and what the wastage and expiries look like in those places. But there is a more deeper dive in the country. So we look at each store level. So we look at the central level of how they're performing, and if they're having any challenges with their stocks. And at each store, at the first subnational level, the second subnational level, and the last 3-4 months, we have also started taking data from the lowest distribution points or the health facilities. So it is expanding a little bit over the last months and so. And of course, once you have all of that information, it gives you a lot of opportunities to analyze it in different ways. So we do a little bit of projections as well at what countries has, how long would that take them, if there are the shipments, are they going on time, and if also to do some quick comparisons of how the quality of that data is while looking at each month, but then comparing it again with the last 12 and 24 months and seeing if a country is reporting 7-8 months of stock of a certain antigen, and how did it end up having 50% of the time that they were low stocked or they were even stocked out. And of course, then there is the coverage data, and the red dots all denotes the impact of the pandemic on each antigen by country, and again comparing it also with the global averages. So from the last year and a half that since we implemented it, we tried to track a little bit of did it change anything on the ground. So one, of course, the visibility has increased significantly. We started very small in about 12 countries in just their national levels, and now it's in 63, and we're in about 7,000 stores as of end of May. We also took some examples from the countries to see. I didn't put the names there deliberately, but there are countries we were looking at the total number of stores and tracking that against whether we have what proportion of the stores report on Thrive. And comparing the last year or the last 12 months, we're seeing there is some modest improvement in stock management practices in the countries. And we can see that by the reduction both at the national level, at the first sub-national level, and also at the district levels. But we've also narrowed down the categories that causes those stockouts in those countries. And a lot of them have to do with the delay in funding, in some places the delay in procurement, and the lead time that have not been followed, and that causes these stockouts from happening. But we're also seeing there is a reduction in the duration of the stockouts as well. So we'll talk a bit more about when the frequency in the how long those stockouts were. So also late last year, we started integrating all of this Thrive into DHIS2. And the purpose was that if we can do this type of analysis at the global level or at the Unicef regional office level, it would make a lot of sense if we put it back in country and allow managers at the different supply chain levels within the country to take this information and make decisions that will prevent that stockout, but most importantly, resolve the in-country problems with the stock management. But of course, giving them their own data back doesn't make a lot of sense, right? So it makes sense that if we can combine it with other critical pieces of the information in this space. And that is just to take the supply chain data and put it side by side with coverages data like some of these great surveys like the MIX and the DHS, but also with some estimation projections like Unique, and the admin sources of data, but also with the evaluation and assessment data. The countries have the EVM assessment, and a lot of them have very rich data sources on supportive supervision. So if we can bring all of this information in one place for the managers within the DHIS2, then which already does 70% of the job, because there are already rule-based access to DHIS. People do not need a lot of training. So that then create an actionable platform for managers to prevent those stock risky situations from happening in the first place. And this is one example of how countries now track their demanded forecast against consumption. And this they can do this by antigen and at the store level. So what it will tell them is that if you see that there is ups and downs in consumption in a certain month, that would make sense. But if you're taking it for the last 12, 18 months and you're seeing that there is a significant difference between what they forecasted that they would need and what they're using, then that should alert the decision makers to take decisions whether they will have a surplus within the next 5 or 6 months, or they would face a shortage. And if they're facing that shortage, what should they do about it? How can they resolve that problem from happening? And also, what's the implication of that shortage would be in terms of finances, so they could take these decisions on time and source the funds that are required to help them prevent the stock out from materializing. So these are all within the DHIS2. Bruno and team have worked a really great job in putting all these scorecards based on the information that is within those countries, and automating the data integration within the other sources. So what this does, it gives the managers a quick snapshot if they're logging in from a national level to see which districts within their country has the most problems and where they have to focus. So, and that helps in channeling the resources in the technical assistance that goes into the countries on those specific areas that are continuously performing below the expectation. It also provides these scorecards that gives that clusters the health facilities within those countries. For a district manager, for example, when he or she logs in, he would only see the health facilities within his area or her area, and they could also see what health facilities or what cluster of health facilities are contributing to the problem that they're seeing. And this will be my last slide. And this is an attempt at if we could use all of that rich information that is available within the DHIS2 and through all other systems and see if we can predict the stockouts, and we could prevent it before it materializes and causes the problem. So this first attempt is to take a couple of indicators and create an index that would rate the districts or the health facilities, or as you go up the geographic levels. And it will take the historic stockout from the last 12 or 24 months and combine that with the coverage rates, the the EVM E6 scores in the population of 0 dose in that area, and give a rating to each district. And based on that, and of course, these things will improve over time. So we'll test this to see if certain areas that have higher probability of stockouts materializes. And if that happens, then managers in those places can take timely action to prevent that from happening. And then also putting each of that district or health facility side by side with the 0 dose population and the coverage rates to say if a certain district has reported that they had good stock management practice in the last 12 months or 24 months, but they only have a 30% coverage rate and they have very low wastage rate, then where are the rest of those vaccines going? And again, vice versa, if there is a large number of stockouts reported, there are a high percentage of wastage, but they're still reporting 60% or 80% coverage rates, then again, that's a question of where did you find those additional vaccines to vaccinate those children. So I'll stop there and see if there are any questions.
We don't have any questions from the online, but from the room, if there's any questions, we can take 1 or 2 now. Yep. Right, Greg.
You said 7,000 reporting sites. I was just wondering how you're getting the data into your system.
So whatever the country has, so it's a country system. If they're using an LMIS implementation, that information comes from there. If they're using another system and they feel comfortable, some countries give us access to their system, so we extract the information from their system. Others just dump the file somewhere and we extract what we need. For some countries that have that do not feel comfortable with sharing information through an API or a dump, we have a template where they collect information from whatever system they use and they share that information with us. There is also some countries who have implemented the Web SMT. There is already a built-in report inside Web SMT where they click a button, they download that information that are going into Thrive. But it's a country, whatever the country is.
Do you mind if I just add one quick point that some of them are already reporting in DHIS2? So again, with my first point to make use of what's already there, we had a webinar just in December showing immunization stock data in Nigeria, where 27,000 facilities are actually reporting, about almost 5,000 of those at the site. So So it's using data that's already in DHIS2. It's not reinventing the wheel, and it's making use of what's in the country. Just as one example.
Right.
Claire?
Hi. So I work in WHO and interested in a lot of the work that you've been doing on LMIS. One of the questions that I have is, from a data perspective, WHO is empowering countries to take ownership of their data, not have like international organizations having a lot of the data that is being produced on a country level. Is that something that is being taken into consideration here as well?
Well, absolutely. This is the ownership of the information, of course, is within LWG, and that's why going back to the DHIS2 is that it would be within their hands. The purpose is here to strengthen the stock management within the countries, and it's not something that should be brought into an HQ. But the problems that I mentioned at the beginning was coming, and we were seeing more and more countries requesting preponement of their next year shipments. There was a fix on allocation levels. There were, and we have some more information. There were places that had stockouts of over 6 to 9 months at a time. That, of course, that corresponds very well with the coverage rates in those places as well. So that is the reason why we wanted to create, to bring this information that is shared by the NLWGs to ensure that we prevent or minimize the stock risky situations. But the information is for the countries, and it's going back to the DHIS2, and it would be within the NLWG or the Ministries of Health. So we are absolutely aligned on that. Thrive has also been launched together with Gavi and WHO, so it's not something that is a standalone UNICEF initiative. And there's a monthly report that also goes to both agencies when it's generated.
So each Thrive system is in the country owned instance. Yeah. Sorry, last question then, here.
It's just, I mean, this is for vaccines, right? So my question is anything of expanding this to essential medicines? Or are you staying with the vaccines?
So at the time, we only have vaccines and the relevant consumables, the devices, syringes, and diluents. We haven't moved from the space yet to the rest of. Well, when it comes to DHIS2 and it's in control towers, then of course there is the possibility that you open up, and that's precisely the reason why we're integrating it with DHIS2, that it would tap into all of the information that's already existing there. So it's not just us who create some of these dashboards, but these are the managers at the country level who would then customize it the way they want these dashboards to work for them.
Great. So we'll stop there for this presentation, but thank you again to Zabi. And he'll be around so you can come with more questions, and I'm sure he'll be happy to speak to you. We actually have Rogina now online from ICRC, so International Committee of the Red Cross, who will present then their PSM project, so their pharmacy stock management tool, which is the transaction-based tool which George showed, which is integrated into DHIS2. She'll show how they've implemented it in their projects and also how that's integrated with Oracle ERP. So very relevant on the model that's being used. And without further ado, welcome Rogina. Yeah, in just a moment. If you can unmute now, we see the presentation, Rogina.
All right. Can you hear me?
Great. We see you and we see the screen, but we can't hear you yet.
Is it better now? Do you hear me or still the same? Can you please confirm?
Okay, we see you're unmuted. Can you try speaking
Can you
again?
hear me now? Is it better?
With the right speakers? Can you try again, Regina?
Can you hear me?
No, we're still not hearing. Okay.
Audible online.
Okay, so the people online can hear you, but not the people in the room. If you can all go online, well.
Is it better now? Can you hear me online?
Can we
Oh,
try one more time?
can you hear me?
Yeah, we hear the test sound.
Can you hear me now? That's weird. Can you hear me now?
Yes, now we hear you. Yes. Well,
Perfect.
all right, so now we have Regina, who will present the PSM project.
Yeah, thank you, Bruno, and good morning, good afternoon, and good evening, everyone. I'm really excited to be joining this conference this year, although couldn't make it in person, but happy to join it online and to give an insight on the pharmacy stock management tool that the ICRC have been using since last year, and the deployment is ongoing in 2023. My name is Regina. I work at the International Committee of the Red Cross, also known as ICRC, as the deployment coordinator for the pharmacy stock management project. The objective of this project is to deploy the pharmacy stock management tool globally across the health facilities that are supported by ICRC on a regular basis. In this session, I will be covering the following different topics, starting with the background, why the solution was created or developed, what are the different components of the solution and how does it work, and where we are in terms of current deployment and where we are heading in the future. So I would like to start this presentation with a short introduction about the ICRC. ICRC is a neutral international organization that is based in Geneva and was founded 160 years ago. The core mission of the ICRC is to provide the humanitarian assistance and protection to the victims of war and other situations of violence. Today, with over 20,000 employees across more than 100 countries, ICRC provides different activities, starting from detention activities, but also on health, ecosec, economic security, water and habitat, and so on. Under the healthcare programs, ICRC provides a continuum of healthcare activities, starting from first aid, pre-hospital care, primary healthcare, hospital services, rehabilitation services, and as well as healthcare and detention activities. About the PSM project, the project was created beginning of 2022 with the aim to deploy to develop the PSM tool and also to deploy the tool across the ICRC assisted health facilities. PSM is one of the digital health solution in the ICRC under the digital health portfolio that is used with the aim to store, manage, and also record the data, collect the data from the health facility level. It is an outcome of the close collaboration between the University of Oslo, particularly the LMIS team with Breno and George. The solution was tested in Somalia in many health facilities before the solution went live as an official deployment. And since mid-2022, we have been able to deploy in 6 countries, and the deployment is ongoing with a target of 80 health facilities for this year. Why did we develop the PSM? So the facilities that the ICRC supports are supported either on the regular basis or are supported on the regular basis, which could be monthly as well as quarterly. These health facilities are the stock management in those health facilities were paper-based. due to the manual nature of the work, it was also very slow and was subjected to different errors. There was no consistent data collection methods and reporting, which also made it, there was lack of visibility of the data, which also did not allow advanced analysis and no real-time monitoring of the data. So there was really a missing piece of data at the last mile at the health service delivery level. And in order to overcome this problem, the solution PSM was developed with the idea to have a simple, minimal, and efficient tool that standardized the stock management system and also the replenishment system across all the health facilities that the ICRC is supporting. The idea is also to make the efficient and effective impress management system and to also improve the demand forecasting and stock optimization at the health facility level by removing overstock, understock, or on any other stock issues. PSM solution, it integrates 3 different platforms. So we have a DHIS2, IRIS, JD, or Oracle, and then the Tableau. As you can see in this diagram, on the left-hand side is the DHIS2 data, and the right that comes from the health facility, and on the right side is the JD, Oracle, and the IRIS, which is the logistic management information system that is used institution-wide in ICRC. So basically, once the health facility, from the health facility label, the storekeeper or the pharmacist enter the data in the mobile application, the data, once it is synchronized to the DHIS2 server, it is available in the DHIS2 desktop or the web portal that the program manager or the logistic program manager can use to really change the impress label, to review the impress label. Once this is done and synchronized, the data passes through the ODS, which is our operational data store. So the data from the health side, from the pharmacy or the health facility label, passes through the is pushed towards the ODS, and also the logistic data also let's say it is pushed towards the ODS, and through this joint integration we have advanced analysis that gives advanced dashboard and gives a more like a comprehensive overview of the whole solution in Tableau, which is the data analytics tool that we use in the ICRC. So it's really an integrated solution in terms of giving a global overview of this global overview of the stock management system through bringing in the different data elements from different data sources, as you can see here from the DHIS2 and also the logistics side. And there are different data elements, as you can see here from the DHIS2. We take the stock on hand, stock distributed, and impress label that we take. And on the IRIS side, we mostly take the logistic data on the supply side, but also the pharmacy item codes and description. And through the integration of these 2 information, there is an advanced analysis that is available on Tableau that really helps and guides the decision making around the stock management for the program managers. Why DHIS2? I think for us it was particularly important for us, it was particularly important because it is an open source application. It has been widely used by different ministries and different partners, agencies, etc. So it was available as a public health good. The other functionality, knowing the context where we operate, it was also very important for us to have something that works offline and also in the low internet coverage. So that was also one of the benefits that the DHIS2 could bring. And also the system, the DHIS2 could function on the tablets. That was really an added value as well, that the storekeepers or the pharmacists can use tablets to record their data at whenever it is required. In addition to that, ICRC had already used a different DHIS2, let's say, different health information tools that was based on the DHIS2, such as COVID tracker, and other database as well. So in terms of infrastructure and knowledge, also we were equipped, and it was the best solution for us to go forward with. And as I mentioned earlier, because of these the DHIS2 really allowed us to integrate the PSM system with other institutional platform, particularly on the logistics side, to really give a 360 overview of the stock management was really an added value as well to why we thought DHIS2 would be an added value for this solution. This is a solution overview in terms of what are the different components that the tool is made up of. As you can see here, for us, the eligibility is all the health facility that receives the donation or the regular supply of from the ICRC. It's relatively simple in terms and minimal in terms of in terms of infrastructure. As you can see, mostly we ask tablets at the health facility level that the storekeeper can use to record their data. Computers, we normally use the computers or computers are mostly used to review their impress level and also to change it. So most of the time they can use what is already available in the program. So no additional hardware is needed on that side. In terms of length of training, also it's fairly simple, 3 to 5 hours training, because it is very intuitive and embedded in their work, every day-to-day work. It is also that the training is also fairly light and intuitive as well. The other, I think the added value for this solution is that it can also, we have 5 different languages that are available in the system, so it makes it very much user-friendly in different contexts that we operate. And as you can see, for us, the target users are medical storekeepers, pharmacists, but also the health program managers and the logistics as well. So this is just a broad overview of the different components of the PSM tool. Modes of application. PSM has 2 modes of application. There is the basic mode and there is the advanced mode. So for the basic mode, it's really about taking the aggregated stock data at the end of the month when the pharmacist or the medical storekeeper does the inventory. This is the picture that you see here on the screen is a screenshot of the from the tablets. So basically the first line is the line items or the pharmacy items that belongs to that health facility. The first column is the impress level that has been set for that health facility, as you can see there. And you have the stock distributed and stock on hand, where the pharmacy or pharmacist or the medical storekeeper enters the data at the end of every month. So as you can see, the solution is really simple, and it's really intuitive in terms of their daily work as well. On the advanced mode, as the name says itself, it has much more advanced stock management options. We have the distribution, if you see there on the screen on the picture on the top, the distribution, discard, and correction. So there are much more options than what we saw just before in the basic mode. The advanced mode also allows the real-time transaction. So as soon as the medical storekeeper or the pharmacist issues and transaction or dispatches an item to a department in the hospital, or he records the transaction in the PSM. So it makes it real-time visibility of the data that are real-time visibility of the stock movement that is happening from the pharmacy to the different departments in the hospital or other kind of health facilities. One of the unique features of the advanced mode is also the use of barcodes that are tied to each of the line pharmacy, let's say the line items. So whenever the person or the pharmacist or the medical storekeeper wants to issue something, he can use the tablet and scan the barcode that is attached to the respective line items, and then issue that and record the transaction into the system. And once this is synchronized, the data is available at the global level across different management to really have a visibility of the data at a real time. So so on a regular basis, at a daily basis, depending on when the transaction was made. So how does it work? In terms of the processes, it starts with entering the data on the tablet at the health facility level. As you can see on the first one, here the medical storekeeper or the pharmacist enters the data, he synchronizes the tablet, and the data is shared with the DHIS2 server, and then it appears on the DHIS2 web and is visible globally. At this level, at the second stage, the manager, health program manager, or whoever is responsible for the impress management can review the impressed. Otherwise, the list is ready to be put. The list is ready on the IRIS to place an order. Sorry. IRIS is the order management application in the ICRC. So for here, the data that has been taken from the DHIS2 and also the data taken from the JD Oracle are integrated, and there is an embedded formula within the system that automatically proposes the order quantity that has to be done based on the impress level, stock on hand, and back orders. However, the health program managers have full rights to review and to change based on their context and need, and they can place the order at the end stage of this process. Once this is done, the request is being made, and also the data, because as we discussed, as I showed you earlier, thanks to the integration process, the data from the DHIS2 and the data from the IRIS feeds into the Tableau, giving very advanced analysis on different stock management parameters that the health program managers or logistics can use in their day-to-day operations. In terms of current deployment, so far we have deployed in 6 countries: Nigeria, DRC, Democratic Republic of Congo, Central African Republic, South Sudan, Somalia, and Yemen, with minimum one health facility to 22 health facilities per country, which has been the case in, for example, in Somalia, as you can see here in this color, dark brown. We have also recently started the deployment in Cameroon. Most of this health facility, as you can see, is situated in Africa and Middle East. So far, we have deployed the solution in around 39 health facilities, mostly in hospitals and primary healthcare centers. Among these users, there are 3 advanced mode users, which is the case in Nigeria, Somalia, and South Sudan, and for the rest, they are using the basic mode. One of the things that the solution has also really demonstrated is the scalability, and by this I mean that the solution is very intuitive and very easy to use and very much embedded in the day-to-day work of the medical storekeepers and the pharmacist. It has also the potential to scale up in its own. For example, this has been the case with in countries like Somalia and also in Nigeria, where we had deployed a number of health facilities, but once it reaches a certain level, the solution can be really deployed with the minimum support, and more we are seeing this trend. So really, it's really about the simple and intuitive and minimal nature of the solution that it has shown this, demonstrated this ability, this ability of scalability. For us, the outputs and expected outcomes that we are envisioning from this implementation is, of course, besides to have the simple, integrated, and scalable digital solution, it also brings the process efficiency because of the automatization in the different processes that is involved in the stock management. It is also thanks to this component, thanks to the automatization, that this is really bringing in the process efficiency as well. And one of the interesting things is also the availability of the historical data. And I think this can be seen in 2 different ways. Historical, if the health facility is closed at a certain point and you want to revisit the data, this is also something that is feasible to do as the data is stored in the DHIS2, but also for the prediction of the demand or demand forecasting for coming years. This is also something that you can do with the historical data availability. The overall objective or the long-term vision is also to improve the service delivery in terms of properly improving the stock management process and thereby reducing the stock outs or overstocking. And also one of the unique features or added value of this tool is that there is also a big return on investment, especially in terms of stock savings and salary savings, thanks to the process efficiency that it brings. So we have estimated around 30% in overall stock savings and 10% salary savings now over a period of 5 years time. We have also identified some of the factors that that influence, let's say, the implementation and adoption of the tools. I think these factors are more generic, but as you can see here, the first one, human resource factors, the staff in a place where there is a constant turnover, especially in the beginning, this can influence the implementation process. It is also true. Connectivity is also, in terms of connectivity, also it's a big enabler for any of the digital solution, and it is also true for the solution that we are using. Compliance with the data protection and security protocol, and by that we mean the regulatory environment that we work on both sides is also determining factors and that influence the implementation and adoption of the tool. And local ownership, as we all know, is very important to have a buy-in and also to scale up the solution at the local level. So these are some of the factors that we have identified during our deployment process of this tool across different countries. So what are the next steps for us is to continue the deployment with the goal to cover around 300 health facilities that are supported by the ICRC. And we are also planning to integrate other equipment, other solutions such as biomedical equipment tracker tool within the same DHIS2 environment, and to really have this integrated approach in terms of biomedical equipment, but also on the pharmacy stock management side. So these are the future activities that we plan moving forward. Okay, I think I can stop. I will stop my presentation here, and I'm happy to take any questions that you might have.
All right, big thank you to Regina. We have a question from the room here.
We have a central database in our capital city, but we have also a distributed system and distributed database in 64 districts. Can you operate this by distributed system and distributed database using?
This is with the DHIS2 implementation. And which country are you? Which country?
Bangladesh.
Bangladesh. Okay, maybe that's a special case we'll have to look into. It's not something that we've come up so far, but we can definitely have a discussion about that, how this could apply to that context. I think
90% operation is a local database.
Yeah.
But 10%, 5 to 10% is needed to central database. So it is necessary to access distributed database so we can faster more than the centralized query.
Okay, understood. I think we'll have to have a separate discussion to see if that would fit that model. Yeah, next question.
Yeah, I wanted to ask that ODS, whether it's a data warehouse or it's an interoperability layer.
Yeah, Regina, the question is on ODS, if it's a data warehouse or an interoperability layer.
Yes, so it's an institutional operational data store, so that really allows the different institutional database to integrate with each other.
Other questions from the room?
I don't know if that answers your question.
Yes, mine is just a comment. If you are going for DHIS open source, why don't you also consider for analytics and open source, for example, because I see there are some cost with Tableau. So why don't you also consider an open source for that?
Yeah, that's a really good question, actually. I mean, even within the DHIS2, there is a lot of data analytics that can be done, and there are several other applications. But for us, the Tableau was really interesting because it is an institutional data analytics tool that has been used since many years for different kind of other logistic analysis as well and other institutional analysis. So that's why we adapted, in order to be consistent, we adapted the Tableau as our analytics tool, let's say.
Any other questions from the room? All right, so I think that was it. Thank you again, Regina, for a great presentation. Once we got you on, it was really good to see how that's being implemented. I think that's the end of the LMIS tech session. I hope that gave some ideas about the possibilities and opportunities that you have with DHIS2 for stocks. As I said in the beginning, it's very much a use case that was already present long before George or I arrived on the scene, before the University of Oslo and his center decided to invest time and effort and money into developing it. So really what we're doing is guiding it in the best way possible, looking for the best practice, very much looking to collaborate with others within the sector. So we've been very open, and we continue to be open anything that you've seen that you agree or disagree with, we're more than happy to hear from you. And we're looking really to add to this environment. There's somewhat of a fragmented at times a picture. I think Zabi gave a very good example of that with multiple systems implemented in the same country. So we don't want to add to that fragmentation. We don't want to add to the systems, but I hope that it was highlighted in all of the presentations and the message that we're looking to use what's already in place and maximize that, but also not overuse it and look at that integration possibility when you need really, a professional system from the central level. All right. So thank you very much for everybody who participated. Feel free to approach us now if you have more questions, and we'll be here for the use case bazaar tonight and the experts lounge tomorrow and Wednesday night. All right. So thank you again to all the presenters, Regina Online, Zabi, George, and thank you everybody for joining.